Hello dear patients, today we are going to review the case of combination of peeling on penis and herpes. A man came to our clinic who complained on peeling in the area of penis, in the area of testicles and on some tenderness in the area. He didn't have sexual contacts for a relatively long period of time, for about half a year. However, he had allergy in childhood, and after that time there was no severe allergy. Allergy manifested by the fact that he had different red spots in childhood. However, nothing of that kind was observed afterwards. So, analyses from the surface of these rashes were taken, and from inside the canal. Herpes genitalis was found in PCR analysis. This was a second type of herpes. Blood was taken for second type of herpes, and it turned out that immunoglobulin M and immunoglobulin G were positive, which indicates a fresh infection. Half a year ago he had last sexual contact. It's quite possible that this contact led to infection of this herpes. Apart from that, analyses were taken for allergy, immunoglobulin E and general blood analysis. You can watch a separate video about what it is on our channel. He had an increased number of eosinophiles that exceeded the norm 3 times, and there was a 10 times increased number of immunoglobulin E. The patient was referred to a parallel allergologic examination and treatment. What played a role in this particular case? First of all, an infection of 6 months old, considering the presence of immunoglobulin M and second type of herpes, and secondly an allergy that changes immune response in itself. So, this patient has not quite a favorable prognosis, because often these patients have a relapse of herpes genitalis, and apart from that, this allergy induces peeling in the area of penis and testicles. By the way, we also took scraping for fungi from the area of testicles. However, the picture is not quite typical for a fungus here. However, during any lesion of testicles in the form of peeling, it's always necessary to take scraping for fungi, because here the lesion can have an atypical picture that we noted several times already. Scraping for fungi was negative though. Therefore, in people with allergies, an infection combined with balance of immunity and virus have their own cause. It's quite unique and they often mask each other. Allergy and herpes do that. Usually, the prognosis of these diseases is unfavorable. They often have regular relapses. So, an anti-allergy therapy was prescribed for this patient. Sodium thiosulfate, calcium gluconate, antihistamine medications in combination with antiherpetic medications. Gradually these rashes resolved. However, in 3 months the patient came to us again with a relapse of herpes genitalis, as we presumed initially. Therefore, it's not always the case, but in some cases the cause of rashes on the same genitals can be very different. This is not only the combination of sexually transmitted infections, but the combination of herpes with an allergy, as in this particular patient's case. If it's necessary to diagnose and treat any rashes in the area of sexual organs, you can consult venerologists, urologists and gynecologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.